For the last few years, individuals, organizations, and the government have been looking at ways to treat and help islanders with addictions. The need for a recovery centre for youth was identified, and the Reach Centre in Stratford opened and offers a variety of programs to support young people in recovery. Tonight, a first is happening at the Reach Centre, the first meeting of SMART Recovery. You can find lots of information about SMART Recovery online and testimonials on YouTube. Rose Barbour, who through her blog and advocacy work has done a lot to help families coping with addiction. Well, Rose and Nicole Publicover have both taken the SMART Recovery training, and they'll be leading tonight's meeting. Nicole, Rose, welcome to Mainstreet. Thanks for coming in today, and especially thanks, Nicole, because I know you're getting over a cold.
Thank you. Thanks for having us, Karen.
Maybe we can just back up a little bit. How did SMART Recovery evolve?
Well, I had a son who was in recovery, and the 12 steps weren't really for him. He didn't like that type of meeting. So I thought, there must be something out there that's not 12 steps for people like him, because there are a lot of people like him. So I looked on the internet, and I didn't see anything on PEI, but I did find different types of meetings, and one of them was SMART Recovery. And I really liked the format and that it was something completely different, so that people were going to have a choice. So the 12 steps, it's really great and works for a lot of people, but not everybody.
And 12 steps, if people aren't aware, that's AA and NA primarily that you're talking about?
Yes, that's exactly.
Well. And gambling.
Gambling, yep. Yeah. And certainly they've helped a lot of people recover. But there were a lot of people that it wasn't working for them. So we really needed another option here. SMART Recovery was what I felt would fill a gap. So I took the training about just over a year ago. I just loved the program. I thought it was so practical, and really anybody could incorporate a lot of it into their own lives. My plan was to start up a SMART Recovery meeting, but then things came up where I had more opportunities with addictions, like being offered a seat on the Mental Health and Addictions Advisory Council, and I was starting a family support group as well.
You're busy, Rose.
I am. So in fairness to my family, I thought I better not start something new.
Nicole, why were you interested in SMART Recovery?
I really like the base that it has in cognitive behavioral therapy. So that's a really effective technique, and it's used to treat depression, anxiety, and addiction as well. So it's based on science, and I like the fact that as addiction changes in society, the treatment can change as well. So it's up-to-date current research that it's based on, and the techniques and tools that we teach people to use.
You mentioned cognitive behavioral therapy. You mentioned up-to-date on scientific research. How does that work into a meeting with SMART Recovery?
During the check-in of a meeting, people will bring up issues that they're encountering in their recovery at the time, and there are specific tools based on the stage of change that the person is at in their addiction that they can use to combat these behaviors or to overcome the sort of maladaptive thinking patterns that they so often encounter with addiction, right? Like it's very negative. It's very common for people to get into a negative self-talk state where I can't do this, or I have to be able to do this to be successful, or I'll never recover from my addiction. Yeah, it kind of brings a positive spin to it. Instead of you're an addict, it's you have experienced this addiction, but here are some tools for you to get past that and to become more than that. You're a person first, right?
So people don't end up just with that badge of addiction.
Yes, SMART Recovery, they don't use labels. You know, when you introduce yourself, you would just say your name because you're a person first. You don't say I'm an addict or I'm an alcoholic. They discourage the use of labels because of the negative images, and it's not
stigma.
Yeah, and not great for the self-esteem to be labeled with something.
Does SMART Recovery go with this notion that once an addict, you're always an addict? Or are you done with those labels altogether?
We don't use the labels at all. So we're focusing on the underlying behaviors of the addiction, not the fact that you're an addict. And I'll put my finger quotations up there. But
yeah, and it's not a lifetime program either. They don't measure your time in recovery. The goal is to give you the tools and the strategies you need to live a balanced life so that you don't have to keep coming back. Now, it's set up for people, they can come for months or years if they want to, And certainly they could come for the rest of their life if they wanted to as well, but it's not set up that way. It's meant to teach you the tools and empower you. The thought is that you have the power within you to manage your recovery.
The end goal is that you will be able to use those tools on your own in your own life and move on past the addiction.
If I can just stick with the labels for a second, because I know this is an issue in the AA and NA and addictions community now, in that some people are not being accepted or made to feel good about their recovery because they're using other medications, methadone, Suboxone. So I guess there is this thinking among some that if you are replacing a drug with a drug, then you are not in recovery. Where does SMART Recovery stand when it comes to those kinds of solutions that people are using?
Well, SMART Recovery is an evidence-based program, and according to the World Health Organization and Leaders in Health, medications are some of the most effective treatment for opiate addiction. So SMART Recovery supports the use of addictions medication.
Who do you think this group is for?
There are no age limits, so the group is really for anybody who has some type of behavior that's affecting their lives. So it can be for anybody who wants to come. And SMART Recovery is a good program just on its own for some people, but there's also people who are also doing 12-step programs who want something different as well, and they do both, and that works as well. They'll find some differences, though, when they get to the meetings, like the use of the labels, for one thing. And also with SMART Recovery, you don't need a higher power. You can have one if you want, but it's not part of the program.
Nicole, you took the training as well. What impressed you the most about it? Like, why did you go from that point to being part of this first meeting tonight?
When I first got to PEI, I just moved here in September. I had contacted Rose asking, I knew that she was really active in the field through my aunt, and so I asked if there was anything that I could do or take part of or start off, as that's my background is addiction education, and she recommended the SMART training, just because I think that's a pretty huge gap here on PEI. There needs to be choice for people in their recovery. I mean, addiction is so different, and depending on the drug of choice and depending on the individual, it's a huge gap that you have to kind of cover in the treatment options.
I'll just mention one more difference between the 12 steps and SMART Recovery for anyone who's interested in that. In SMART Recovery, we focus on the present. Now and what might happen in the future is what's important to your recovery. So we're not rehashing the past or anything like that.
So you're not going into, the blame game or, it's all my parents' fault or whatever.
No, because we don't live there anymore. So, you focus on now.
Progress, and it's moving forward, overcoming that negative thought pattern that gets you into trouble.
Thank you very much for coming in, and all the best with it.
Well, thank you so much, Karen. You're very supportive of all our addictions programs and new initiatives, so we appreciate that.
Rose Barbour and Nicole Publicover are leading the SMART Recovery Group. It's meeting tonight at the Reach Centre, which is 223 Mason Road in Stratford. Starts at 7 o'clock. All ages are welcome, and they plan on having childcare. If you need a lift, you can contact Rose or Nicole through Facebook, or you can call 902-316-1252.